Hello and welcome to the show today. Today we're blessed to have with us Dr. Aldene Zeno. Dr. Zeno, welcome to the show.
Thank you for having me.
So let's get started by having you tell the audience about yourself.
Sure. So like you said, my name is Dr. Aldene Zeno. I'm a urogynecologist. My specialty is in treating women with pelvic floor disorders that most commonly includes bladder leaks or urinary incontinence, pelvic organ prolapse, or like vaginal hernias and vaginal bulge, among other disorders. I am based in Glendale, which is in the Los Angeles metro area in California. And I wear several other hats. I'm a mom, I'm a certified personal trainer, and someone who's, enthusiastic about fitness, and all that ties into, my clinic offerings and some of the other things I do, including the book that I recently authored, and some of the wellness programs that we're rolling out in my clinic.
When I did a lot of training, there were women with all of these pelvic floor issues that we did not know what to do with. So it's certainly wonderful, that that's what you do, that's your expertise. Because women become so frustrated, they don't know what to do, nobody can really help them. And so that is extremely valuable to women, but most people don't even realize that that is an option. So let me just start by asking you, what sorts of symptoms would a woman have that should prompt her to ask for a referral to see someone in your field, or who should just go out on her own to seek your expertise or the expertise of a colleague based on where they are?
Yeah, basically the disorders I deal with are not necessarily life-threatening, but they're huge quality of life issues. So basically for any of these conditions, if they're causing you to change your social calendar, if they're limiting the activities that you can do, if they're impacting your finances because you're having to buy diapers or pads because of bladder leaks, for example, any of these, quality of life type things, then it definitely deserves attention. Rarely, again, there can be severe issues like, for example, frequent urinary tract infections and, some of the complications related to that with these disorders. But for the most part, what a lot of women come in saying is a lot of this started, around my pregnancy, or for people who have never been pregnant, they have these symptoms, but they feel like they've been dismissed, especially because they've never been pregnant. And a lot of women deal with these issues for decades because most commonly they tend to get treatment either around menopause or after menopause. So in a lot of cases, it comes down to recognizing that these are problems, even though, again, they're not life-threatening necessarily. And for that reason, they may not even come up for people that are going to their routine health checks. So recognizing it's an issue, and then also, like you said, recognizing that there are experts who specifically treat these conditions.
And I think it's important that sometimes women are embarrassed, particularly if their practitioner is a man. They don't want to say, I'm urinating on myself. And there can be a stigma associated with it, and they don't seek treatment. And sometimes treatment is available that can really change their quality of life.
Absolutely.
And so it's important for women to come out of the closet, so to speak. Hey, I'm having this issue. I need it to be addressed. And if you don't feel comfortable talking to a male provider, you may want to seek, a female. But that is something that sometimes comes up just during the regular review of systems. You're asking general questions. Oh, yeah, I do have that. But she hasn't really looked into it.
Right. Yeah. And we've found that I think there's been more awareness, especially around incontinence, because we know that can be a huge quality of life impact for people on fixed incomes, for example, where we see this condition most commonly later in life. Costs around like continence supplies, like diapers and the pads, or, PureWick or whatever, a lot of those costs really add up. We also know that for some families, it's a big challenge when they're the caregivers for an elderly family member, And for some people, it ends up being a reason for admission to nursing homes. For my younger patients, I sometimes see that, especially for like young mothers or people with other children, it really limits their ability to care for their kids. So some women are scared to pick up their child because they're worried that they're going to leak or they're going to feel, a prolapse symptom like that hernia type thing I was mentioning. Or they feel like they can't be as active. They can't run. They can't jump with their kids or with their family because they're worried about leaking everywhere. So I think it's kind of two-sided as far as the stigma goes. There's stigma in the sense that a lot of people don't take it, either they don't take it seriously or they feel like other people don't take it seriously. And they often laugh it off like, oh, I just laughed so hard, I peed myself the other day or something. And they hear or see these things and feel that it's not taken seriously. But on the other hand, it's such a common issue that if people were really to have these honest conversations about it, they'd probably be surprised that they probably know someone in their own family or in their circle of friends that's also dealing with similar issues.
And taking it a step further, as an internal medicine physician, I've had so many people who came to the hospital with heart failure. They didn't want to take their diuretic because they didn't want to urinate on themselves. And so for those individuals who have congestive heart failure, and they're prescribed medicine, or even if they're prescribed medication, a diuretic because of difficult to control high blood pressure, sometimes they just want to take the medicine because they don't want to urinate on themselves. So during those episodes, there could actually be very, very profound consequences. I spent most of my career as a doctor in the hospital, as a hospitalist, and so many cases of severe hypertension requiring admission or severe heart failure requiring admission are related to, I'm just not going to take it. I've got to go out and run errands. I don't want to urinate on myself in public, so I'm just not going to do it. And so that is, what you're doing, that is really profound. And for a lot of people, it can go way past the quality of life. It could go to the realm of life itself, because you're not going to take a diuretic and you have a stroke because of the high blood pressure, or you end up on the ventilator, or have a heart attack in the face of severe heart failure. That can be literally a life-threatening situation. So we don't always think about it in that way, but coming from my perspective, I've seen that over and over and over and over again. And women need to know that there is help, that they don't have to miss their fluid pill, their diuretic, for a very serious condition because they don't want to embarrass themselves in public.
Yeah, that's such a good point. And we also know that these issues around bladder control also relate to this idea of frailty, that people, and it's a little bit of a chicken and egg thing, but people who deal with these issues later in life are more likely to have problems with potentially muscle wasting, with having potential accidents, like, for example, getting up at night, potentially tripping, trying to get to the bathroom. That's unfortunately a common thing that I hear. And it really does, in some cases, limit people's ability to just be more active, up and moving and leaving the house and engaging in their social circles and things. So it really is a part of healthy aging to address this issue. And I do think more physicians are becoming aware and some patients are becoming more aware, but that's certainly one of my roles as a urogynecologist, is to help spread the good word about our treatments and these issues.
And you brought up just another aspect, not wanting to get up and move. So we know that a sedentary lifestyle decreases your life expectancy. So that's another unexpected side effect of untreated urinary incontinence. People don't want to move. When they don't move, they're more likely to have a heart attack, diabetes, and other things, which can take them earlier than need be. So there are so many, it's like you have this root and then, these branches that just keep coming out. There's so many potential negative consequences of untreated urinary incontinence, in addition to, just the fear of being embarrassed.
Yes, 100%. Yeah.
Okay. So what else would you like to share with the audience today?
Along with these conditions, bladder control problems, prolapse, which I mentioned is like a hernia through the vagina. A lot of them tend to be age related. So we can see these issues in younger people. And I've treated, teenagers even, unfortunately, with these problems, but they are more prevalent in older patients. And since I treat women, a common condition that I also see related to this is related to menopause. And so just kind of organically in my training and career, I've taken it on myself to do additional certifications and learning, more ways that we can help support women in menopause, because we know that a lot of these issues are related to the way that our hormones change as we age. And that impacts so many other things when we're thinking about, our quality of life and ability to stay active and fit while aging. So that condition, it's not necessarily a disease, right? Half our population will go through it at some point. But in some cases, it can be quite debilitating for people, and everybody's experience is unique. But I think the biggest thing, kind of along with the other conditions I treat, is just recognizing the impact that it's having on your own life. Understanding that there are treatments out there and that there are experts, with kind of a wide variety of options when it comes to treating menopause as well.
That is vital. And when we look at the whole scheme of things, we look at surgeons, we look at, all these specialists and so forth. And really, there are a lot of issues that people may not necessarily consider to be that significant, that serious. But as you've talked about, the quality of life is huge. The ability to exercise is huge. The ability to safely and comfortably take the medicine you need to prolong your life. Those things were important. And so I'm so happy to have you on today, because the potential to really impact a lot of lives is huge. Women just need this information. They need to know that there's something that they can do about it. They don't just have to, shrivel up and say, this is a natural part of aging. I'm not going to enjoy the things that I used to enjoy. And so there are so many different levels of what you do that can positively impact people. So I thank you for that.
Yeah, thank you. Yeah, as a urogynecologist, a lot of people assume if they're coming to see me that, I'm signing them up for surgery, which is part of what I do. That, I do surgeries for different women's health issues. But probably most of my time is actually spent on clinical treatments and partnering with other specialists like pelvic floor physical therapists, or with, internists and lifestyle medicine physicians and others who really play a big role. And again, like you said, it's about healthy aging and, really helping women thrive, because like I said, a lot of these women start having these issues when they're young. They deal with it, for decades, and then it kind of accelerates as they're going through menopause. We know now that the bladder itself actually has estrogen receptors. We knew that there were vaginal estrogen receptors in the vagina. We know that estrogen plays a really big role in helping maintain healthy microbiome, or healthy bacteria, and healthy overall, environment in the bladder and the vagina. We used to think the bladder was completely sterile and that, there's no bacteria in it, but we actually know that there's probably good bacteria that help to maintain a balance in that area, just like in our gut and things like that. So really, when I'm talking to people about managing issues like overactive bladder, or stress incontinence, or prolapse, or bladder pain, frequent UTIs, it really is taken in the context of, other factors in their life. And especially since we see this most commonly in middle age and in more seasoned women, a lot of that conversation also involves managing and optimizing hormones. And for me, it's something that's fairly simple. Like low hanging fruit for me is giving women, prescribing women vaginal estrogen, which we know helps reduce urinary tract infections, improves overactive bladder symptoms, and helps with painful sex due to vaginal dryness. So for me, that's low hanging fruit. But for a lot of women, there's just so much misinformation about hormone therapy, a lot of confusion, even, that they're getting from their medical providers about, safety and efficacy and things. And so, one of the things I really enjoy, besides being in the operating room, is being, that resource to, provide women a more, I guess, balanced option. And to help them understand again that there's, treatments out there that we know are safe and effective.
Yes, I love it. So we're going to take a quick break. And I understand you wrote a book, so I want to delve into that when we come back.
All right, sounds
We'll
good.
be right back. Hello, I am Coach Dr. Ann, and welcome to the World of Women Wellness Warriors, other known as WOW. A 2024 report by the World Economic Forum and the McKinsey Health Institute noted that each year women lose approximately 75 million years of life due to poor health and early death. The World of Women Wellness Warriors is a global sisterhood of women who want to be empowered. So we're back with Dr. Aldene Zeno, and we're going to talk about her book. Dr. Zeno, tell us about your book.
Sure. So my book is called Thriving Through Pregnancy with Fitness and Black Mama Magic. I wrote this a couple of years ago and then published in January of 2024. The reason for me writing the book is kind of twofold. One, as a health expert, I wanted to provide to kind of meet a need in this space about fitness and especially representing women of color in this space. When it comes to fitness and pregnancy, when I talk to my colleagues that are taking care of pregnant women, overwhelmingly they said we have a harder time convincing people that they're okay to move during their pregnancies. And when you look at the guidelines from our national society, from ACOG, it actually says that the recommendation is for people to have pretty much the same activity as if they're not pregnant. So still recommend 30 minutes, 5 days a week of moderate intensity exercise, which, which is the recommendation from our, government health society. But again, a lot of people lean into this idea that, they're supposed to rest more when they're pregnant, or that if they do certain activities that they're going to increase their risk of pregnancy complications. And that is possibly true for a small minority of people, but for the vast majority of people, we really want them to come into their pregnancies healthy, to lead healthy lifestyles while they're pregnant, and to also safely continue that postpartum or after they deliver, so that they can set their children up for success. So that was one, reason for me writing the book. The other part was for me as a mom, having gone through my own pregnancy. I came in fairly active. At the time, I was mostly doing CrossFit and functional exercise. My partner is a personal trainer, and when I looked for guidance at the time on fitness and pregnancy, and this was, early in the pandemic, I didn't see a lot of resources that offer guidance on doing moderate or high intensity exercises, weightlifting, running, those types of things through pregnancy. Most of the books that I saw were around doing yoga and Pilates or other like low impact activity, which I think is great. But I knew that there were a lot of other people like me, just from, being at my own gym, a lot of people like me who were looking for more, objective guidelines or expert guidance on this. Because this adage that if you were doing it before pregnancy, you can keep doing it, may not necessarily be true, because so much changes over 9 months. Trying to do a clean when you're in your first trimester is not the same as when you're in your third trimester. So I learned that from my personal experience, but was excited to put this into a book and to kind of do the research around that. And then as a woman of color and as a Black woman, I also just didn't see that representation when we had discussions about maternal health. When we talk about Black maternal health, we often just jump to, concerns about morbidity and mortality, which are very legitimate concerns. We need to have those conversations. But I think in order to move the needle on that conversation, we also have to promote and support healthy lifestyles and show that in media, in books, and in movies. And so I was honored to have partnered with Siobhan Robinson, who's a celebrity personal trainer. She herself has gone through 2 pregnancies and stayed active. She's helped train artists like Alicia Keys and Cardi B and her. And so being able to put that all into a book just really was so special to me. I'm so proud of, the way that we included, photos throughout to help people stay inspired to stay active throughout their pregnancies. I also included recipes, and it really takes people from preconception before they get pregnant to postpartum or after they deliver. And I ended the story with doing my first triathlon at 2 years after I delivered. And so again, just featuring how it's possible, sharing these stories from my own perspective and from Siobhan's perspective, but then really kind of grounding that in the expert guidance and the evidence that is out there on this topic.
So the suffering and death and so forth among particularly African American women, that is huge, and that's a conversation in itself. But I do want to ask you, this is wonderful that you wrote this book, first of all. I think it's very needed. Is there anything in this book that you think would not apply to a woman who's not African American?
Just to clarify, would not apply to a woman who, and I didn't hear the last part.
Who's not African American, who's not a Black woman.
Oh, this book is for everybody. Yes, this book is for everybody. Again, like the real focus of the book was to put together the latest evidence on health in pregnancy, on fitness in pregnancy. And that definitely applies to everyone. There's some guidelines out there, but that's all that they are. They're guidelines. And so I really wanted to dive deeper into that. And again, I would say, especially people who are interested in staying active during their pregnancies, which hopefully everyone is, but people who are looking for more guidance than, if you're doing it before, you can keep doing it. That may not necessarily be true for everything or for everybody, or who are just looking for some validation or support that it's okay they want that permission to be active. So yes, this is absolutely for everybody. And it just highlights my own experience, and also has the goal of showing, representation from a group that is often not represented in this light.
So where can people pick up your book?
So my book is currently on Amazon, and they can search Zeno Black Mama Magic.
Great. Okay. And also in the description to this video, we'll just add a link to the book.
Oh, I appreciate that. Thank you.
So is there anything else you want to share with the audience today?
No, just, I think a common theme with the things that we talked about today is to, you have to, in a lot of cases, be your best health advocate. And what that means is starting with kind of assessing your own health goals and understanding your current situation and how your health or, areas where it may be lacking or where you want to improve it, recognizing how that's truly impacting your life. When you're able to kind of put that into words, I think that helps your care provider, whether it's a physician or other clinician, to understand, how they might be able to assist you, and just recognize if you're not getting the answer that you need in today's, age of over information. I think in a lot of cases, there's just lots of resources, whether it's from patient support groups or clinician support groups. There's a lot of information out there where you can get, potentially a second opinion or just find another provider that will hopefully help you meet those health goals. people. So thank you so much for having me. And I really do hope everyone feels empowered to take charge of their own health.
That's what it's about, empowering people to make positive changes. And I thank you so very much for coming on the show, and you have a blessed day.
Yes, you too. Thank you.